Media briefing for Wednesday, December 16th, 2020. Joining us today is Mayor John Tory and Toronto's Medical Officer of Health, Dr. Eileen de Villa. Mayor Tory?
Well, good afternoon. Today, our city faces a grim reality. More than 50,000 cases of COVID-19 have now been recorded in Toronto, and today alone, Dr. de Villa will be reporting 850 more cases in a single day and 19 more deaths in one day. 19 of our fellow Torontonians gone at the hands of this deadly virus. Like every city, we are seeing far more COVID-19 cases than we ever wanted to when this nightmare began. I know people are tired of the restrictions, they're tired of the current lockdown. But what is absolutely clear from everything we are hearing from our public health professionals and hospital officials right now is this. Going back to the good old days, as much as we might want to, is just not in the cards. And the fact is, we should be doing more, not less. Dr. de Villa will be speaking this afternoon about the real risk of what can happen to our city and its residents and the healthcare system in the coming months if the virus continues to spread. She will also be presenting data that we have received last night that shows how quickly the virus has spread in the last few weeks, despite our current lockdown measures, and how effective the spring lockdown was earlier this year, especially by making sure that people stayed home. I believe it is important that every resident has the same information that I have and that our officials have as we try to manage this pandemic at City Hall. I hope that it will help encourage everyone to do the right thing over the Christmas holidays. And that's one message that's probably the most important that we're going to try to convey to you today, to do the right thing over the Christmas holidays. Our public health officials in the different governments, including those in this region, are in discussion right now about this and whether we can use the holidays, a traditionally quieter time, to lock down even further. This is something we're already seeing in other jurisdictions, including right next door in the province of Quebec. I've already asked our city officials to review all of our own facilities and our own programs to see what more could or should be shut down or modified to help further stop the spread of COVID-19. We know no matter what governments do, much of our success fighting the spread of COVID-19 in the coming weeks will rely on how people choose to spend their holidays. And make no mistake, it is a choice that you will make, you collectively and you as individuals. People did the right thing during Easter. Now, admittedly, that's not as much of a family holiday, perhaps. It's not as one that's celebrated by as many as Christmas may be the case, but people did the right thing at Easter. That was more towards the beginning of the pandemic. But they kept their own households and they avoided the usual large family gatherings that accompany a holiday like that. The cell phone data clearly shows that people stayed put far more then than they're doing now. And Dr. de Villa will share some of that with you. Together, we have to go back to the behavior that we adopted in the spring. Today should be a jolt for all of us. We need people to follow the public health advice over the Christmas holidays. If you are planning to gather with people outside of those who you live with, in spite of the public health rules, we need you to rethink your Christmas plans right now. The more people who gather together this Christmas, the more COVID will spread, and the more strain we will see on our hospitals, the more lives that will be lost. That includes placing in more danger the people that we have quite rightly elevated as heroes in our society, in our city, in our province, the frontline healthcare workers who are put more at risk by behavior that encourages the spread of COVID-19. The more we don't follow the public health advice, the more we put those courageous people who are serving us in hospitals and elsewhere at risk. The more of them get sick, the less the system, the health system, will be able to cope, the less it will be able to look after us. This is about making sure as many people as possible get through the Christmas period this year and are healthy and able to celebrate Christmas next year. We don't want to look back at Christmas 2020 ashamed that collectively we didn't do the right thing in this region And as a result, lives were lost, or people, including our frontline healthcare workers, were put at even more risk. I know, like many of you, we're increasingly feeling positive right now that COVID-19 vaccine is here and that hope lies ahead, and it does. There is a light at the end of the tunnel, but we aren't out of the tunnel yet. So this Christmas, stay home as much as possible. If that means even now that you have to change your plans, please change them. I heard a woman talking on the radio this morning. She said she was trying to decide whether to go and see her parents or not, and she thought she would. That was the wrong call. That was the wrong call. As much as she wants to see her parents, and they probably want to see her too, that was the wrong call. Just gather, please, with the people that you live with. Hook up with others on Zoom or on FaceTime, or even a good old-fashioned telephone call. We all need to make this sacrifice now to protect our families and those who we care about. And now I would like to ask Dr. de Villa to provide an update on today's numbers and the modeling that we asked to be done for Toronto, which I think you'll find very instructive. Dr. de Villa?
Thank you, Mayor Tory, and good afternoon. I'm reporting 850 new cases of COVID-19 today. This, again, a record high of new reported cases. There are currently 281 people in Toronto who are in hospital with COVID-19, and 68 are in the ICU. Sadly, 19 people have died. Today, the youngest person amongst those sick enough to be in hospital is 23 years old. In the last day, a 47-year-old is the youngest amongst those reported to have died from COVID-19. With today's cases, Toronto is now past 50,000 confirmed cases of COVID-19 since the start of the pandemic. The risk of even more widespread illness is real and rising. Let me show you a visual. The blue part of the graph shows the rise in cases from the start of the pandemic in Toronto to the point we reached 25,000 confirmed cases. The pandemic started last winter. It took us from January 25th until October 20th to reach 25,000 cases. But it took just shy of 8 weeks to double the number of cases again in Toronto to more than 50,000, shown in red. That's the reality of where we are today. I'm sorry to say how clearly it speaks for itself. But this is only part of the story. When we talk about cases, it's important to remember the cases that we report only reflect the tip of the iceberg. The number of true infections is much larger than the cases we report. We report on cases in people who tested positive. What we don't capture are infections that aren't symptomatic or are so mildly symptomatic that people don't think that they have COVID and don't get tested. Those people are able to spread infection and never know it, possibly spreading it to someone who won't be as lucky to experience mild disease. Turning to the next slide. This slide shows how much time people spent at home between January and early December of this year based on anonymized cellular data. More importantly, it shows that staying apart works. Last spring, we were able to flatten the curve. Today, We know that people aren't staying at home as much as they did back in the spring, thus creating more opportunities for virus spread. Our call to action has never been clearer. I cannot urge you strongly enough to keep apart during the holidays. Many of us celebrate with one side of the family one year and the other the next. Many of us have family and friends across the country and around the world. When you think about it, we've been connecting with each other by phone and by computer for decades now. And the connection is real in spite of the distance. So keeping apart actually isn't that unusual for us at the holidays. It's just that this year, we have to keep apart more than usual. This year, it's not distance that lies between us, but COVID-19. I know it seems hard to imagine it's necessary, but many risks are converging in the holidays this year. The risk of infection, the risk that infections could turn serious or deadly, the risk that infections rise so significantly that the healthcare system is swamped, or worse, overwhelmed. Given where we are now, all these things are very real possibilities, which points to the greatest risk, our ability to deny what we don't want to deal with. As a doctor, I've seen this too many times, leading to outcomes that could have been prevented if only we'd acted sooner. I will say it until the last minute. The holidays in 2020 pose a real threat and demand difficult decisions from all of us. COVID-19 can make things much, much worse in Toronto if we make it easy. This holiday, from now into the new year, it is vital that we all find a way to connect, but commit to staying apart. I know many of you are acting to protect yourselves and the people who matter to you this holiday season. In the coming days, I'm asking all of you who are doing differently over the holidays to lead by example and to speak up. Directly encourage the people you know and care about to commit to the same thing, keeping apart for the good of everyone. The more voices there are taking a stand, the more impact our resolve will have. Thanks for your attention, and I'll now turn it over to Brad.
Thank you, Dr. de Villa. Before we go to questions, just a reminder to reporters, you will need to unmute yourselves to ask your question. And first up, Chief Peg is on the line should you have questions for the Chief. First up is Sneha Agrawal from CBC. Go ahead, please.
Thank you. My question is for Chief Peg and Jessup. There have been multiple fires at encampments, and allegations are that some may have been set deliberately. Are you investigating? Is the fire marshal's office involved? What can you tell us?
We'll go first to Chief Peg, and then Chief Jessup is also on the line. Chief, go ahead.
Thanks, Brad, and thank you very much, and good afternoon. Without any doubt, the issue of encampment fires has been a significant issue for us over the course of the year. We have responded to 241 encampment fires year to date, and that's a 243% increase year over year. In fact, we've managed 10 of these fires just since December the 11th. I can tell you that there is no indication that any of these fires are connected, meaning that each of them are individual events. We are fully engaged in all of them. Our investigation teams actively investigate each of the encampment fires, and where they meet the protocol to engage the Ontario Office of the Fire Marshal, we do that. And that is certainly any time that there's a critical injury, anytime there's a fatality. Those are two examples of when we would engage the Fire Marshal's office. Many of them are investigated in collaboration with Toronto Police, and we have a number of those. In fact, the fire from early this morning on Fleet Street is an example of a fire that remains under investigation collaboratively between Toronto Fire Services and Toronto Police.
Thank you, Chief Peg.
You have a follow-up, Sneha?
Yes, please. What's happening with the encampments now where there have been fires? Are people allowed to return there?
I'm sorry, could you repeat that?
What's happening with the encampments now where there has been fire? Are people allowed to return there?
Okay, I'm going to ask Marianne Bedard from Shelter Support and Housing to address that one. Marianne, please.
Thank you, Brad, and thank you for the question. This is a really important issue because we are significantly concerned about the number of fires. I'm happy to report that our Streets to Homes team engaged with everyone at the Fort York encampment last night. Everyone that remained on the scene did accept referrals to indoor services. And so we were able to support all of the people there to come inside where it is warmer and also safer.
Thank you, Marianne. I'm sorry, Ms. Mary. Yes, please do.
May I just say that we continue to take this entire matter, as we have from day one, seriously, with the great help of our public servants, including the Streets to Homes team in particular, that I expect there will be some proposals that will come before City Council while it's meeting this week to try to further enhance the offerings that we have available to people who are in the encampments. But I would remind people that we have rehoused 1,100 plus of those people since the beginning of the pandemic. Our efforts will not let up in that regard, and that we're adopting, I think, a sensitive, sensible approach to trying to deal with this precisely because they're not safe, they're not healthy, and they're not legal. But we're doing it in a sensitive, rational way and trying to offer as many other options as we can with the help of our public service team. And so that effort will continue, and if anything, be stepped up.
Thank you, Mayor. We'll go next to Haley Cooper from News Talk 1010. Haley?
Thanks so much. My two questions are for Mayor Tory. Mayor Tory, have you been in discussions all week with Premier Ford about next steps, and what do you want to see specifically in terms of tighter lockdown restrictions?
Well, I'm not going to get into the details that I have discussed with Premier Ford as recently as early this afternoon, but I will say that I think that anything we do should be done with some notice ahead of the planned expiry of the 28-day lockdown that we're presently experiencing. I think we need to do more and not less. I think it needs to be regional in nature so that we leave people with fewer options as to other places they might go. We need to get back to the personal behavior, as Dr. de Villa and I have both said, of the spring, when people, as we can see from the anonymized cell phone data, people did stay home. And that's first and foremost, more so than any government relation, any government order, any government framework, any government color code. We need people to stay home and to socialize only with the people that they live with. That's what we need more than anything else.
Thank you. And my follow-up also for Mayor Tory. Some city councillors are intending to ask council to request the federal government to expropriate vacant hotel and apartment units for urgent housing. So can you just explain what this is intended to do, who it's intended to help, and also how this would work, especially when it comes to the vacant apartment units, because this would be private property, no?
They're talking about private property, and that's why I find it such an extraordinary answer. But we do have an extraordinary problem. I don't support this way of going about it. As I indicated, we've been working hard to bring some proposals in front of the City Council, which quite frankly can provide hopefully some further housing options for people in encampments and others who are homeless that can be effective much sooner than the expropriation process, which if you follow it in a way that I think we would all expect when you are trying to buy private property, that takes years sometimes. And so we need to act sooner. I don't think the expropriation is at all even close to being an appropriate remedy for that. And we will be coming forward with some other ideas sometime in the next very short period of time while council is sitting.
Thank you. We'll go next to Dave Woodward from AM 640. Go ahead, Dave.
Thank you very much for taking my question. My first one's for Chief Pegg. Even with the warnings about the gatherings, I think it's fair to say that some families will still be gathering over the holidays this year. Will enforcement be ready to break up these family gatherings over the holidays?
Chief, if you want to go ahead, and then I'll perhaps ask Carlton Grant if he'd like to answer.
Sure. Thanks, Brad. So our coordinated enforcement teams will continue to operate as they have throughout the pandemic. And that means that we are ready and able to receive complaints relating to gatherings on private property. The appropriate mechanism to submit those is, of course, by 311. They are received, they are prioritized, and then actioned accordingly. So our teams will be ready to respond to complaints relating to private gatherings as we have in the past. Although, as we have all been very clear, and Mayor Tory's been very clear, there is no possible way that we would be able to patrol or inspect every residence and every private gathering in the city. And ultimately, success over the course of the holidays will be dependent on each one of us making appropriate decisions. But should complaints be received, we're prepared to respond. Brad, I'll turn to Carlton for further.
Thank you. Carlton, anything to add?
Yeah, well, I just want to concur with what has been said already by Chief Pegg and Mayor Tory in the past, that we need to prioritize and triage these in such a way that we're responding to the larger events. We cannot be everywhere at all times, and again, responding to 2 or 4 or 6 people together when we really need to prioritize the larger events. And it's really incumbent upon the residents of the city to follow the rules.
Follow-up, Dave?
Yeah, my follow-up is either for Carlton or even Mayor Tory, actually. One of the issues, and maybe why people are still gathering despite all the warnings, is I think that because we're not hearing about individuals being held accountable for gatherings. In fact, if anything, we're hearing that businesses and owners are being held responsible, while people who gather, they get warnings or let off the hook altogether, like at Adamson Barbecue. Is it time to start finding individuals and maybe even naming those people who flaunt the bylaws?
Well, I will start only because I have expressed an opinion on this from the beginning, but my opinion is my opinion, and I don't direct what law enforcement or courts do. I would charge everybody involved at this stage, when we've been at this for months and telling people that these gatherings are contrary to the guidance or to the law, or both. I would fine everybody, or at least give them a summons and have them in court. And if I was the judge, I would give them a substantial fine for doing something that puts so many people at risk, including themselves, but many other people as well, and that represents such a deliberate thumbing of nose at the law, which I take very seriously. And so in my case, but I think you have to come back to the fact that in the end, even if you applied that policy, we don't have, and we don't even want to have, enough people to be going around and knocking on everybody's door and saying, how many people have we got in here at the table? I mean, surely we haven't arrived at a point in 2020 where there's nobody left with any personal responsibility for this, and everybody relies on bylaw officers and police officers and neighbors across the street, Doris Kravitz or whatever her name was, that called in these things. I mean, surely we're not there. I mean, surely people can decide to change their plans such that they just have dinner with the people that they live with. And so that's where we really are. It's not about the fines and who gets charged and who doesn't. It's about people just deciding they're not going to go to parties and gatherings like that, and they're not going to hold them.
Maybe I'll just ask Carlton to clarify exactly how fines have been issued. Carlton?
Yeah, absolutely. And I think clarification is important here. The Toronto Police Service is the lead on large gatherings, and we support them, and we've both been responding to these gathering calls. They have issued a number of charges, both to the organizer and the attendees. And again, each case is different, each case is complex, and each case requires the discretion of the officers that are on site. It is not as simple as it appears. There's a lot that goes into it. And, holding people in a room so we can issue them tickets is contrary to what we're looking to do. Often when the police show up, people flee. But again, the police and MLS have been actively working to go after the organizer and to go after the attendees where we can.
Thank you, Carlton. We'll go next to Dave Ryder from the Toronto Star. Dave, go ahead.
Hi there. My first question, I guess, is to Mayor Tory or Dr. de Villa. You're saying you won't give any specifics about what's on the table, but Mayor Tory, this morning you said, look at Quebec, and you also said, look at what we did in March, which kind of leads us and the public to try and connect dots or figure it out. So in the same way that you're pleading with Torontonians to do something, I'm pleading with you to say, give some examples of what's on the table, understanding, and we will report responsibly that they will not necessarily happen.
I think both Dr. de Villa and I should comment on this, but I would just comment for myself. The kinds of discussions, if you want them to be frank and candid and to be able to have a good dialogue back and forth that I would have with the Premier or with some of my other colleagues as mayors and chairs in the Toronto region, can't proceed properly if we're all putting all of our ideas out. And I think that furthermore confuses the public at this stage when we're trying to formulate the right thing to do. If you look at my views expressed over time, you will see that I have said I am favorably disposed myself to some sort of a break in the schools, for example, that goes on a bit longer and perhaps has some virtual learning taking place into January. I have said that it should be regional. I have said that I think we might take some lessons from what Quebec has done with respect to offices and non-essential businesses going into the early part of the new year. And I do believe that whatever is done, we should have a very robust, complete plan to reopen businesses and other things as soon as circumstances permit. But I think beyond that, in terms of getting into a shopping list of, which is essential and which isn't, or does it mean this or does it mean that, we do have to have some time to discuss, especially if we want to do this on a cooperative basis, which I really think we do with the expert advice of our health advisors, but also cooperative as between all the governments involved, because I think that will be less confusing for the public and more effective in terms of its result.
So Dave, I'll just add a little bit to that which the mayor has said. There's no question that the discussions occur more freely and are more productive when we're able to have them with our partners first before sharing them publicly. But I think you can count on the fact that those discussions are actually relying on the science that exists and our experiences and the experiences that we see from other jurisdictions. That where and as much as possible, we need people to continue to maintain the self-protective behaviors that we have been speaking out for the last several months now. Watching distance, wearing masks, washing hands, limiting social interactions to the greatest extent possible, really focusing on close contact only with those with whom you live. To the extent that government intervention can support people's ability to engage in those self-protective behaviors, those are the kinds of things that I think you will hear about, that we are talking about, and hopefully we'll have something to share with the broader public in the near future.
Thank you. My follow-up, I think, is for Dr. de Villa, and that's given some significant outbreaks we've seen in correctional facilities, do you think inmates should be a vaccine priority, and if not, why not?
So, David, I think when it comes to the issue of who are the priority populations and how they will be ordered and managed, this is the responsibility of the provincial government. Here at the local level, we are certainly listening and cooperating and collaborating with the province in respect of those things that we are able to support. And primarily that will be through such things as implementation and vaccine clinics, as you've heard us speak about at previous press briefings. But I would ask that when it comes to priority populations, this is in fact a provincial decision, so best to speak with them about those issues. But clearly vulnerability to COVID-19 has got to be one of the considerations, and situations like congregate settings where COVID-19 can more readily spread, especially if it's amongst individuals who are particularly at risk for COVID-19. These are the kinds of factors that go into that decision-making in priority setting.
Thank you. We'll go next to John Chidley-Hill from the Canadian Press. John, go ahead.
Good afternoon. My first question is for Dr. de Villa. Downtown Legal Services has written to you asking that you use your legal authority to suspend evictions until the pandemic is over. Will you do it?
So, this is, you're quite right. I did happen to receive a letter on this subject. And, let's start off with this first and foremost. From a public health perspective, there is no question that access to safe and affordable housing, and for certain populations with particular supports, is absolutely critical to health. And it is especially important in the context of COVID-19, that individuals who become infected with COVID-19 are able to effectively isolate in order to prevent the spread. So there's no question that public health, including myself and Toronto Public Health and public health authorities the world over, will tell you how important housing is. That's why we have a motion that we put before the Board of Health, and that was, again, recommended and moved by the Board of Health in respect of eviction prevention measures that we're asking the provincial government to take on, as that's the most effective level of government, or where the most effective action can be taken. So I think that's first and foremost. In respect of the specific letter, it is something that I will be reviewing with legal counsel and looking at very carefully. But I think we should be patently clear that when it comes to matters and issues around eviction prevention, that's most effectively conducted at the provincial government level.
Thank you. I have a follow-up for Mayor Tory. Advocates say a temporary freeze on evictions doesn't go far enough to address the unaffordable housing crisis in Toronto. How do you plan to address that as the city hopefully begins to recover from the pandemic?
Well, I think we were hard at work addressing the affordable housing situation with my top issue, and will be my top issue into 21 and after the pandemic is over, as it was before the pandemic began. I've said in some of the interviews I've been doing as we reach the end of the year that the only thing that will now rival affordable housing as a priority issue for us as a city will be the economy, because of the damage done by the pandemic and having to get back on our feet economically, because again, people are going to be better able to provide housing for their families if they have a job. But with respect to affordable housing, I would match what we have done in the last couple of years through Housing Now, through Open Doors, through the initiatives we're undertaking with the huge support of the federal government on the Rapid Housing Action Plan, modular housing. There's just a whole host of things that we're doing that have us at a level of productivity in terms of the increase in supply of affordable housing that is probably not been matched for decades in the city government. And we will continue those efforts in partnership with the other governments with a view to providing 40,000 new affordable homes, let alone all the other ones that will be built in Toronto in now what is about 8 years left in the time period that we set out. And we're well along to meeting that goal. And that's exactly what I'm most determined to be doing when I get a bit more time. We're carrying on with the work, but I think we'll be able to focus even more intently on it when we bring the pandemic to an end, which really relies on, yes, vaccinations, but even more so people's decisions they make about their personal behavior.
Okay, well, thank you. We'll go next to Morgan Campbell from Global News. Morgan?
Thank you. Just one quick follow-up to the encampment questions earlier. Just wanting to know if there are any plans to dismantle the encampments, and what is the city doing, to stop people from creating and continue to create these types of encampments?
I'd like to answer that first, because I hear this debate going on, and I would like to say to the people of Toronto that I think we've adopted an approach with respect to the encampments that is exactly what they would want us to do. I've said as mayor, others have said correctly, these encampments are first and foremost not safe, they're not healthy, and they're not legal. But that the approach that we would take in the city of Toronto is exactly the one we have taken, which is not to go in the dark of night and bulldoze them or take them down and move people away against their will, but rather we give notice, we go in and have conversations with people about housing alternatives that we are prepared to provide for them, which we have successfully done for more than 1,100 people. And there's a few hundred left, and I'm not trying to minimize that number, but it's down to a few hundred now, who we have to continue to do that work with. I will say to you, they're being told in some cases not to go to some of the housing alternatives we offer to them because they will catch COVID, which is an irresponsible thing for people to say, because we've also moved thousands of other people around in the shelter system so that it will be safe from the standpoint of public health And I think the record will show that the shelter system has been remarkably safe throughout this pandemic. And so I wish those people would stop telling homeless people that, because it hinders our ability to help them. But in the meantime, we'll continue with the application of a sensitive policy whose objective is clear, which is first and foremost to find better housing for the people in the encampments, but secondly, to have those encampments no longer in existence in our parks and other public places.
Follow up, Morgan?
No, I think that's good. Thank you.
Okay, thank you. Sorry, Marianne, did you want to add something?
I will just add very, very quickly, because I think it's important to remember that the Streets to Homes program, which is the program that supports people who are staying outside, this is a unit that's been operating for more than 10 years. When we started this in Toronto, we were recognized worldwide for how innovative and how successful that project is. It seeks to connect with people who are staying outside and connecting them directly, primarily with housing, but also with other indoor opportunities. Just since the pandemic has started, we have connected 460 people who have been outside to permanent housing. And that's a significant achievement for this population in order to receive that permanent housing. So we will continue working with our partner agencies to engage with people who are outside, to talk to them about what their needs are, to match that with available housing or shelter options, and making sure that we're continuing to do the program that we've been recognized for and has been around for many years.
Thank you very much, Marianne. We'll go next to Matt Bingley from Global News. Matt, go ahead.
Hi, good afternoon. Dr. de Villa, we heard some talk about modeling being presented, which would present what we would see without further restrictions. And I apologize if I missed a slide if it came up, but can you tell us what you are thinking we could see as in number of cases and even hospitalization rates if the city doesn't go forward with further restrictions?
So Matt, I did not present a slide on modeling, you're quite right, but we did undertake modeling here at Toronto Public Health. And just to be clear, our models that we do here at Toronto Public Health are instructive, but perhaps not quite as sophisticated as which might be done by, the university partners or that which you see provincially. However, they are incredibly instructive and helpful. And what we show it's not so much data on cases, but data on infections. And that was what I talked about within the context of my remarks. Day to day, we come out and tell you about cases. And these are the ones that actually go forward for testing and ultimately test positive. But they represent only a proportion of that which is happening out in the community. We know that there are other infections out there. There are a true number of infections, which we're not really capturing because many people are actually so mildly symptomatic or maybe even have no symptoms. They don't even know they've got COVID and they don't go for testing, so they don't come to our attention. But they are part of the burden of disease and the impact, they give rise to impact in our community. So when we look at our modeling, we look at infections. And we know that there is an opportunity really for all of us by simply staying home and limiting our interactions to the greatest extent possible, really focusing our close contacts only with those with whom we live. If we do that, we can actually significantly change the trajectory of disease and ultimately infections and hospitalizations hugely. It is a significant impact that we can have. What I did show you was that when we stay home, it does make a difference. We know that there are lesser cases, lesser infections, lesser hospitalizations when we keep our distance as much as possible.
Thank you. And to follow up with Mayor Tory, this morning you said that you'd like to ideally get an answer from the province by the week's end to give people time to prepare earlier you said that you had spoken with the Premier today. Has he told you that he will have an answer for you then?
He listened very carefully. We had a very good discussion, a very constructive discussion, as we have throughout today, and he's certainly very clear on my view. And I think he's also a person who understands, very well that individual citizens and businesses, because they all have plans to make, whether it's personal plans, school-related plans, or business plans, need to have as much notice of what you're going to do when it comes to government as possible. So I think he understood that point before I talked to him, and I think he certainly understood it after I talked to him. And I guess now this is all just part of what goes into a whole series of discussions he and I and others are having with Dr. de Villa and other medical officers of health and with each other. And but I think the point has been made clear. Everybody, I think, accepted the fact there had to be a degree of notice of any change that you might make to plans.
Thank you. We'll go next to Catherine Boulot from Radio Canada. Catherine, go ahead.
Merci. Where is the city right now in terms of contact tracing? And can you just tell me if you feel like, Dr. de Villa, it's still relevant right now to inform restriction decisions, knowing that the COVID is so widespread at this point in the community?
So thank you for that question. And it's interesting, case and contact management is one of the many tools that's available to public health within the context of a pandemic. It is, however, a very labor-intensive one, and one that therefore is actually most useful when we're in circumstances where our case counts are lower. So let's look at the graph that I presented earlier this afternoon, just a few minutes ago. We know that since October the 20th, we have had 25,000 cases reported in the city of Toronto. So that's 25,000 cases to follow up on. And when you look actually very specifically at the number of contacts that each case has, we found on average that it's about 20 to 30 for each one, just given the nature of daily life. So just by that alone, you can think about the number of contacts that creates. We're in the range, if it's 20,000, it's another 20 contacts, I should say, per case. You now have 500,000 contacts to follow up on, resultant from 25,000 cases. So it is a very significant issue to manage. But that's why it's so, so important for people to really engage in those self-protection behaviors, watching their distance, wearing their masks, washing their hands, and of course, limiting their interactions to the greatest extent possible. What we have seen throughout the course of the pandemic is that as much as public health can do to support people, what really matters are the behaviors that each and every one of us adopts on a daily basis. And the more we are able to limit our social interactions and really keep things focused on staying at home as much as possible, only going out for those essential activities, groceries, exercise, healthcare, that kind of thing, and the more we are able to focus our contacts or limit our contacts to only those with whom we live, the better we are able to actually control the spread of COVID-19 in our community, and the better the chance we will give to these new COVID-19 vaccines that are just emerging, in front of us now, to actually do their work and to help us, put COVID-19 behind all of us.
Thanks. Just a quick follow-up. The province is still publishing data on outbreaks, but looking at how small of a proportion we're able to trace, do you feel like those outbreak data are still relevant or reliable scientifically at this point?
Well, in fact, for us at Toronto Public Health, we have always continued to do contact tracing within those very high-risk settings where people gather in groups and are likely to give rise to outbreaks. So in fact, we have never stopped contact tracing, even with the high number of cases in these settings like long-term care homes, hospitals, things like schools and childcare. These are the settings that are most likely to give rise to situations like outbreaks just because of the number of people that are there. So those are continuing to be reported on because they are continuing to be followed up as a source of risk.
Thank you. We'll go next to Francine Copeland from the Toronto Star. Francine, go ahead.
Oh, hi. My question is for both Mayor Tory and Dr. de Villa. Understanding that you're discussing next steps with the province, including whether there will be more restrictions beginning Monday. There are steps that the city or the medical officer of health can take on their own in this situation. And I'm just wondering, the situation is dire as you're describing it. Why haven't you moved to use your own tools, the tools that you have at your disposal to increase restrictions?
Well, Francine, on the contrary, in fact, you'll recall that I have used my authorities under the Health Protection and Promotion Act when the circumstances warranted that. But as you've heard the mayor say, you've heard me say, and I'm sure you will have heard others say, that many of the actions that need to be taken, or many of the actions that can actually make a difference in terms of controlling COVID-19 spread, are more effective when done in concert in a more regionalized approach. Again, what we're seeking to do is to create circumstances that facilitate the ability of the public to engage most effectively in self-protection behaviors. So while government can indeed help through the enactment of policies and those kinds of things, it does fundamentally come down to behaviors. And we are in control. We are able to make decisions. It is very much in our hands. The more each and every one of us limits our social interactions, stays at home as much as possible, does not engage in close contact with people with whom we don't live, watch distance, wear masks, wash his hands, the more each and every one of us does this, the more effective we will be in controlling COVID-19 spread. I'll leave the mic for the mayor here.
Well, may I just say, to be clear, that I did indicate in my remarks that I had asked the city officials to come back to me in respect of those things that the city deals with in terms of programs and facilities that could be further closed down. I asked as well that Dr. de Villa look at things that she might do, and in which case that's her decision, but I would support her if there's things we have to do on our own. But I think from the standpoint, and I think the public overwhelmingly support this point of view, that both from the standpoint of what I've been told is medical and scientific effectiveness, but also from the standpoint of avoiding confusion and avoiding giving people alternatives to go somewhere else to do things you don't want them to do here, we are way better off to have something that is truly regional, that extends across this region. And by that, I mean the GTHA, and that is better done by the province. But that's why we're talking to all the people in the region, as well as to the province, as well as to each other. And the City of Toronto will move ahead and do what we can and should do on our own. But there will be other things that would be best done on a regional basis. And that's why we're embarked on those discussions.
Thank you. My second question is for Dr. de Villa. When do you expect the vaccine to start bringing down infections?
Sorry, I'm having mask issues there, Francine. This is the reality of our life in COVID-19. Francine, it's an interesting question, and one for which I'm not sure I can offer a definitive answer at this point in time. We are all still actively learning about the effects of the vaccine. And of course, we're quite hopeful. We've seen some pretty remarkable results. The fact that we actually have a vaccine, I think, is the first remarkable achievement in and of itself, right? The virus was only discovered in January, and here we are in December with vaccines going into arms in a few countries around the world already. This is a remarkable achievement and demonstrates very rapid learning and collaboration and cooperation across the global scientific community. However, there is still more learning that needs to occur. And so I think that while we're certainly hopeful, because the early results of the studies on the vaccines that we have and the results that we have available to us indicate a high degree of efficacy of those vaccines, we don't have the full story yet. And we will have to monitor very carefully before we can make pronouncements around what we can anticipate in terms of protection and what sorts of actions we might take as a result.
Thank you. Final question is to Christina Tenalia from CP24. Christina, go ahead.
Hi, thank you so much. I realize, Mayor Tory and Dr. de Villa, you've commented on this a bit, but we know and you've discussed many times that the issue with COVID-19 in the city and beyond is gatherings and people in close contact with each other. And I'm wondering why, short of going into people's homes, which I know, of course, you can't do and wouldn't do, why do you think any kind of further restrictions, even regionally, would have any kind of impact? And I ask that because last week in the province's modeling update, Dr. Williams and his team noted that this lockdown, this most recent lockdown in Toronto and Peel, did not have as much of an impact, had very little impact on people's mobility and contacts with each other as the first lockdown did. So what would further restrictions do, aside from, again, continue to harm the small business community? Restrictions, of course, are temporary. What would really be the impact?
You know, Christina, I think you raise an interesting question, but I would point you to the evidence that we have accumulated over the course of the past several months. Our own evidence, premised on our own experiences, what's published in the scientific literature, and as well what's published and understood of the experiences from jurisdictions all around the world. When people stay home, when people limit their social interactions, when they really watch their distance and use masks and wash their hands, it makes a difference in terms of COVID-19 spread. This has been repeated over and over and over again. You look the world over, all the experiences that we've seen, both in the early wave and in this second wave now of COVID-19 activity, this has been replicated many, many times over. So to the extent that there are policy levers that might be deployed in order to facilitate the ability of people to really engage in effective isolation or a separation from other people, limiting their social interactions, we know that that works in terms of controlling COVID-19. I'll leave it to the mayor to make his remarks now.
Only to say that the objective in every single discussion we have about these different methods with the medical experts and between and among governments is to help people, not to hurt anybody. And we're trying to avoid a situation which some of the projections and some of the developments we've seen show could be way, way worse in January if we don't take further action now. And that includes way, way worse for business too. Because as we've said many times here, a healthy economy requires healthy people. There have to be healthy business owners, healthy people working in those businesses, and healthy customers in order for the economy to be back on its feet. And there's no one more determined to get the economy back on its feet than me. But we have to make sure people are healthy and that we're not having terrible, unacceptable loss of life. And so, again, what we saw in the spring, and again, we can't go back to the good old days in terms of just sort of turning back the hands of time, but we can look at the behavior we exhibited then. And I think people had more fear of the virus at that time. I think that they also, though, had fewer places to go. Everything was closed. So people, as we've seen from the anonymized cell phone data, stayed home. And what we're saying now is we wouldn't have to do anything more if people just agreed to stay home, to wear a mask when they had to go out shopping or when they had to go to work, to socialize only with the people they live with. If people followed those rules and washed their hands, we would be able to make great progress. But sometimes it's the case that government has to put in place other measures in order to try and, shall we say, encourage that behavior by providing fewer places to go. So I believe that is going to help. If we have fewer places for people to go, then they're more likely to stay home. I think it stands to reason.
And one final question. Thank you very much for Dr. de Villa. Dr. de Villa, why have you chosen not to use your powers as the medical officer of health to close schools for the first 2 weeks of January, which is something the unions have been asking for? I recognize it isn't something that is consistent with the province's plan. The education minister has noted that the advice from Dr. David Williams has been, at this point, that schools will not be closing in January. But this is happening in Windsor, Essex, where right now, throughout the holiday season, schools there will be closed. And I point this out recognizing, of course, the importance that there's been multiple sick kids reports that note the importance of kids being in school for their mental health and well-being. Is this something you're considering, and why have you not acted on that, if so?
So Christina, I think we are always considering the various options that are presented. And certainly those that have strong rationale and some evidence behind them get greater consideration, as they should. But these are not simple decisions, as you've indicated, right? There are a whole slew of considerations that need to be carefully looked at and discussed in order to make these kinds of decisions. As the mayor indicated, you know, we are always trying to strike appropriate balances. We recognize that COVID-19 presents a significant health risk to our community, and this includes our school communities, whether we're talking about children, the staff, or the families of those kids who attend our local schools. So we are constantly monitoring and trying to ensure that we're taking decisions that take the broad perspective of health into consideration. COVID-19 is one of the dimensions that's important to consider. But as you indicated, Christina, so is mental health. So are the benefits of education in the academic sense. But as well, we know for many children in our community, school provides much, much more than that. It is access to sometimes social services that are fundamental to health. So we are always considering what makes the most sense for our unique circumstances here in Toronto. That is a subject that's under active discussion, and we will take an appropriate decision when we have the circumstances that indicate that, or we will take that kind of decision and take that kind of action. That's always been our practice at Toronto Public Health, looking at the data, understanding the situation, taking into consideration the scientific data, taking into consideration the broader health perspectives, and making the decisions that hopefully provide for the greatest benefit to health overall, regardless of what the situation is.
Thank you. That concludes today's briefing. Just for your planning purposes over the holidays, the next briefings will be on December 21st, 23rd, and 30th at 10 a.m. We'll issue an advisory, and if anything changes, we'll let you know. Thank you. Stay safe.